Good afternoon. Thank you for joining us for the August edition of the Lung Cancer Solution Series, a series that is done in part with the Citizens for Radioactive Radon Reduction and the SHEC, or STEM and Cancer Health Equity Foundation. The theme for this year's series is related to the lung cancer risk factors other than history of smoking. Today, we'll make a few announcements. We're happy to have Dr. Joan Schiller here speaking today. She's well published and internationally known and recognized for her work in lung cancer and patient advocacy. She's the co-founder and chair of the steering committee of Oncology Advocates United for Climate and Health. She's served on many advisory boards. She's founded Free to Breathe, which merged with LCRF, and so she sits on the board of LCRF, and she's done a lot of work now really in climate change and lung cancer. So this is what we'll be talking about today. And before I introduce her and let Dr. Berg speak, some couple of announcements. Our next speaker will be October 14th. It will be Laura Stabile from UPMC. And tomorrow, SHEC has its own Just Breathe checking on lung cancer, and we'll have Dr. Melanie Potiompai talking about the role of prehab and exercise and rehab before and after surgery. We also have our Lung Cancer Solutions Conference coming up in October 24th and 25th at the University of Illinois Cancer Center, and you can find out about that on the SHEC website, scheq.org. And with that, I will let it go to Joan and then to Dr. Berg, and then we will go ahead and get started. Thank you, everyone, for joining us.
Oh, great. Thank you, Eugene. Chris, you want to introduce yourself?
Yes, certainly. Thank you, Joan, and thank you, Jean and Jackie. I'm Dr. Christine Berg. I'm a colleague of Joan's, one of the co-founders of Oncologists United for Climate and Health International now, and I've been very active in lung cancer screening. I have a real strong interest in helping us address the climate change crisis. I'm here to listen to Joan's talk and happy to help answer questions at the end. Thank you for having me.
Thank you, Chris. Let me share my screen now.
Yep. And if you have any questions, just type them in the chat box and we will try to answer them as we can.
Okay, well, Jean, thank you very much for that very kind introduction. Sorry. I appreciate the invitation. Chris and I have worked together for a long time on the impacts of climate change and how it affects cancer care. And it is a big problem. Now, I have to tell you that I'm probably going to be using the terms climate change and air pollution interchangeably, which I should not be doing because they are two different things, but they are joined at the hip by the fact that they have one major thing in common, and that is they are both due to the burning of fossil fuels. So let's just talk about climate for a second first. We know that normally the solar energy gets reflected back into space, but some of it when it goes back into space, and some of it gets reflected back onto the Earth, which is a good thing. And the way it's reflected back onto Earth is through greenhouse gases. And it's the greenhouse gases in the atmosphere, such as methane, carbon dioxide, and nitrous oxide, that traps this infrared radiation and re-radiates it back to Earth. And as I said, that's a good thing because otherwise we would have a frozen planet. However, if for some reason those greenhouse gases build up, they will reflect even more infrared radiation back to Earth, thus heating the planet. And it's like a blanket is all of a sudden over the Earth. And what can make those greenhouse gases build up? Well, the burning of fossil fuels. And just to show that we have documented this, one of the fossil fuels is carbon dioxide, and we can measure that. And you can see that in the last 100 years, how much it has totally spiked up. Oops. And so we do know that carbon dioxide is increasing, as are many of the other fossil fuels. Okay. This is a graph from the CDC showing 4 of the main consequences of climate change and increasing greenhouse gases and climate change. And they include rising temperatures, more extreme weather, rising sea levels, and increasing carbon dioxide. And these, in turn, have health effects, significant health effects, such as extreme heat, as we only know too well, severe weather, air pollution. Something we're not going to be talking about today are some of the changes in vector ecology, meaning that some infectious diseases, such as Lyme disease, are spreading more frequently. With the increasing heat, we're getting a longer growing season for plants which cause allergies. All this has effects on the availability of clean water and food. And as the climate changes and the earth changes, we're going to start seeing some mass extinctions of some of our wildlife and and plant life. And all that is going to have an effect on access to care. So let's just go through these one at a time. Let's start with extreme heat. I think we all know that extreme heat is very dangerous. It can cause heat stress, heat stroke and death, cardiac and respiratory failure. What people might not know about is it can also cause premature births and birth defects and cognitive decline, particularly in the more vulnerable populations. And yes, extreme heat is lethal. 27% of heat-related deaths worldwide are due to climate change. It's estimated that by 2080, a 20-fold increase in heat-related deaths projected will occur, particularly in countries near the equator. Here in the US, extreme heat exposure is linked to 65,000 ER visits each year in the US, and that's projected to go up 8-fold by the end of the century. So how does that happen? What are the effects of extreme heat on cancer patients? Well, one of the ways is on thermoregulation, which is our body's ability to regulate temperature. Some cancer treatments can impact the body's ability to sweat and regulate temperature effectively, making it harder for patients to cool down when exposed to high temperatures and thus increasing the risk of heat exhaustion or heat stroke. Some cancer medications can also interfere with the body's ability to regulate temperature. And what that can do is it can alter what we call the pharmacokinetics of cancer drugs, meaning that these altered pharmacokinetics will result in delays in absorption, elimination, and distribution, resulting in impacts on effectiveness. And these drugs can also result in dehydration, particularly in patients with pre-existing conditions who are having problems with diarrhea or febrile illnesses. And very importantly, some drugs have side effects on the neurological system. For patients receiving these drugs, that heat can result in their inability to regulate the body's temperature. And cancer drugs can cause increased photosensitivity, making you more sensitive to the sun's rays. And those drugs include, among others, DTIC, 5-FU, methotrexate, vinblastine, and some of the newer targeted drugs as well, like MEK and BRAF inhibitors. And another way that extreme heat can affect cancer patients and cancer drugs is it can weaken the immune system. We all know that chemotherapy can cause myelosuppression, can decrease the white blood cell count and make people more at an increased risk for infection. And that can be a problem because hot weather can promote the growth of bacteria in food and water, increasing the risk of all sorts of infections. Okay, let's move on now to air pollution. So what is the connection between air pollution and cancer? Well, the most direct effect is that it causes lung cancer. And this is incontrovertible, as I'll show you here. There is also emerging evidence that it can cause other cancers as well, such as breast, brain, and bladder cancer. But air pollution and climate change, they also have secondary consequences. In particular, they can affect access to care. The extreme weather events that we have been seeing lately can result in delays in screening, delays in treatment, and delays in research. We've already talked about the facts that heat can impact the pharmacokinetics and thus the effectiveness of many cancer drugs. Air pollution is classified as a Group 1 carcinogen by the International Agency for Research on Cancer, and that means it causes cancer. And in particular, we know for sure it causes lung cancer. In fact, it is arguably the second most common cause of lung cancer in the world. It can cause lung cancer even in people who have never smoked. It is estimated that air pollution is responsible for about 14% of all lung cancer deaths worldwide. So how does that happen? Well, it turns out that air pollution contains very, very small particles called particulate matter. And these can be very small. These can be very small. The ones that I think are most concerning are ones that are 2.5 micrograms in size. These are smaller than the human hair. You can see how small they are on here. And they, as I said, come from burning of fossil fuels in factories, power plants, motor vehicles, gas stoves, fires. And what happens is these get into our lungs, and there they can cause inflammation and cause lung cancer. But they can also get into the circulation and causing all sorts of problems due to chronic systemic inflammation. And that chronic systemic inflammation can have significant health effects, such as cardiovascular and pulmonary effects. PM 2.5 is small enough that it can this chronic inflammation can result in such things as platelet aggregation, vasoconstriction, all of which can affect the cardiovascular system and the pulmonary system, such as and cause things like bronchitis, pneumonitis, COPD, and asthma. So once it gets into our lungs, it can cause, like I said, something called oxidative stress, which means low-grade chronic inflammation. And that low-grade chronic inflammation can cause all sorts of molecular changes in our DNA, such as causing DNA mutations, among other things. Now, it may take time for these DNA mutations to accumulate. They will accumulate, and as they do, they will slowly turn a normal cell into a cancer cell. This is one of multiple studies. This is just one example of multiple studies that shows there is a relationship between lung cancer and air pollution. This particular study surveyed over 635,000 individuals from 1987 to 2014, and they found out that individuals living in areas with high air pollution were at an increased risk of dying from lung cancer. This number right here, let me get this out of the way. This number right here is called a hazard ratio, And if there was no difference between people who were exposed to air pollution and those who were not, the hazard ratio would be 1.0, but it's not. It's 1.13. And that means these individuals had a 13% higher risk of dying from lung cancer as the air became more and more polluted. Now, they also identified within these 635,000 individuals that roughly half of them had never smoked. And look here at the hazard ratio in these people who had never smoked. They were at a 73% higher chance of dying from lung cancer if they were exposed to higher and higher air pollution levels. This is a bit of a complicated slide, but it's yet another example showing us how we know that there is a relationship between lung cancer and air pollution. This is a study from Taiwan comparing the northern section of Taiwan with the southern section. The graph on the left shows the amount of air pollution in southern Taiwan, and that's in red right here. And they are comparing it to northern Taiwan, which is green. Here they're looking at visibility, which means as the amount of air pollution in the air went up, visibility decreased. You can see that until about 1992, the visibility in northern Taiwan was higher than the visibility in southern Taiwan. And then around 1992, things started to change. And that was because the visibility in southern Taiwan got worse. That was because they had started building more factories in southern Taiwan, whereas in northern Taiwan, they started to clean things up. The visibility got better. And what they did was they constructed a mass transit rail system. They moved factories outside the city. On the right-hand, here we go. Sorry. On the right-hand panel here is the incidence of getting advanced lung cancer. And what you can see here is the visibility in southern Taiwan got worse over time. The incidence of advanced lung cancer in people who had never smoked increased. And as the visibility in northern Taiwan in green got better, the incidence of getting advanced lung cancer leveled off. And I just want to remind you, this is all in people who had never smoked. And not surprisingly, for those individuals who have been already diagnosed with lung cancer, air pollution shortens their lives. In this graph, you can see the risk of dying of lung cancer is related to the amount of PM 2.5 in the air. When the concentration is up to 16, the risk of lung cancer goes up by 60%. Dying from lung cancer goes up by 60%. Now, I know there are many places on the globe that are combating wildfires. These wildfires are becoming more common and they're burning more intensely and they're lasting longer due to increasing heat and droughts. And they too are a form of air pollution. But just because we're not immediately threatened by wildfires does not mean we're not affected by them. This particular slide is from a photo taken in New York in the summer of 2021, but there are similar photos taken every place else in the world in 22, 23, 24, and 25. Pardon me. And what it shows is that the smoke from the West Coast, for example, can gets blown across the United States and blankets parts of the United States that are not on fire. And as I said, here is the Northeast, and this is an example of what that smoke, which started here in the West Coast, can do to the East Coast. More recently, we're seeing more and more wildfires from Canada blowing their smoke down. And so this is becoming more and more of a problem. But does exposure to wildfire smoke cause lung cancer? Well, this is a study from Canada. They found there was a higher incidence of lung cancer in people exposed to a wildfire within 20 kilometers or 50 kilometers in the past 10 years. So again, these are hazard ratios, and you can see they're all above 1, saying that these people who were not directly exposed to the fire, but lived within 20 or 50 kilometers, were at a higher risk of dying of lung cancer. This slide here on the right looks at brain cancer. You can see there's a similar association with brain cancer. A recent study found that PM 2.5 from wildfires is 10 times more harmful than PM 2.5 from other sources. And that's because it contains other pollutants. Often these wildfires burn through towns and contain pollutants from the burning cars and the burning houses, for example. And they therefore can cause more oxidative stress, more chronic inflammation, and become more harmful than PM 2.5 coming from man's burning of fossil fuels. And of course, all of this will have effect on the outcomes of cancer patients. This was a survey of California radiation oncologists, which evaluated the emergency preparedness and the effect of wildfires on radiotherapy services between 2017 and 2022. And you can see that over 60% of these clinics reported being affected by wildfire. These included clinic closures, staffing shortages, being forced to transfer patients. And from the patient's standpoint, over 50% of them had to cancel or reschedule treatments, and 55% had to evacuate. Of all these clinics, only 40% had a wildfire emergency preparedness plan. This is a study that looks at this is a study that looks at people who are recovering from lung cancer surgery. So they've had their lung cancer taken out. And here they're looking at how close these people post-op were related to a wildfire. And again, if you just want to look at the adjusted here, just for simplicity's sake, you can see that if they the time from surgery to wildfire exposure was less than 3 months, they had a 43% higher chance of dying. Now, remember, they didn't have cancer, they were post-op. 7 to 12 months from being exposed to wildfire smoke, a 17% increase. And what about this? I showed you the effects of wildfire smoke on radiation therapy clinics in California and how it affected the clinics. It also, not surprisingly, affects the patient's overall survival. This is a study that looked at patients with locally advanced non-small cell cancer who had a wildfire disaster and patients with locally advanced non-small cell lung cancer who were receiving curative radiation therapy were exposed to wildfire smoke within 12 weeks. And what you can see is, once again, they had a worse survival than those patients who were not exposed to wildfire smoke. And I think for the sake of just time, we will just move on. But we all have to remember that not all air pollution comes from the burning of fossil fuels or from wildfires. Some of it comes from recreational wood smoke, and that is turning into more and more of a problem. Recreational wood smoke also contains toxic compounds. It contains black carbon and And experts say that a single fireplace operating for an hour, which burned 10 pounds of wood, generates 4,300 times more carcinogenic elements than 30 cigarettes. This is a study also illustrating that. This was called the sister study. And what they did was they got over 50,000 women who had sisters who had breast cancer. So the participants did not have breast cancer, their sisters did. And what they looked as to whether or not these women were exposed to indoor wood burning stoves or fireplaces. If the people were not exposed to wood burning stove or fireplaces during this period of time, they found 754 breast cancers, 567 of which were invasive. If they had been exposed to indoor wood burning or fireplaces, they found 1,500 breast cancers. Over a half of them, 3/4 of them, were invasive. And as you might expect, the more smoke they were exposed to, the higher the chances of getting breast cancer, particularly invasive breast cancer. They also happened to look, as it turns out, at lung cancer. And again, they're looking at whether or not patients were exposed to indoor wood burning stove or fireplace. And if they were not, the chances of coming down with lung, if we just want to look over here at the hazard ratio, if they were exposed to indoor wood burning or fireplace smoke, the hazard ratio was 1.42, meaning they had a 42% higher chance of dying of lung cancer. And this was true even for never smokers. If they had been exposed to a lot of wood burning stove or fireplace smoke, the hazard ratio was close to 2. They're almost twice as likely to die of lung cancer. Now, so we've talked about various sources of air pollution, sorry about that, including wildfires. We're not going to have a chance to talk about other sources of indoor air pollution, such as the burning of methane, which the manufacturers of call natural gas. Natural gas is really methane, and methane is a greenhouse gas, and also from chemicals from products. So let's move on now to access of care and to extreme weather emergencies, which I know we have all seen over the past several years. These can include more severe and frequent and longer lasting events such as hurricanes, floods, and sea level rise, as just some example. And when there are these big weather emergencies, access to care was really impacted. That includes limited access to food and safe water for people exposed to these, contamination of water and food sources from waste debris and other pollution, increased risk of infectious diseases due to lack of safe water and adequate hygiene, disruption of services at hospitals and clinics and healthcare centers, reduced ability to access these healthcare centers or medicines or oxygen or other essential health items, including chemotherapy. And other items we don't always think about, such as effects on delayed treatment for other diseases, such as cancer and diabetes, and mental health issues, including stress, depression, and suicide. What the health facilities have to cope with is infrastructure damage and destruction, managing their workforce, who's going to be able to make it to work, who isn't, who is going to take care of the children of those people who made it to work, etc. Healthcare facilities have to cope with the loss of medical records and tissue samples. And one example of that is Hurricane Allison, which hit Houston a number of years ago, really flooded out the basement of the hospital there and resulted in the loss of invaluable medical records and invaluable tissue samples. Healthcare facilities have to be thinking about how they're going to evacuate the patient and staff and to where. How are they going to deal with the disruption of communications? Because as electricity goes out, many other things can go out. How are they going to be able to communicate with each other? And not only lack of infrastructure, but also things we might not immediately come to mind, like medications, IVs. What if somebody's at home with an IV? Oxygen. Lots of cancer patients have oxygen. Or pain meds. Lots of cancer patients take pain meds too. And if they have to evacuate, they may not be able to find those in timely fashion. And something else we don't always think about, these extreme weather events can result in accidental release of toxic carcinogens. During and after Hurricane Harvey, for example, there were more than 100 toxic releases from 40 different sites, releasing over 365 tons of hazardous chemicals. And again, something we never used to think about, but we're starting to think about more and more and more, is that of the supply chain. And a good example of that is when Hurricane Maria struck Puerto Rico in 2018. It turns out there was a factory in Puerto Rico that supplied the bulk of IV bags for the United States. But when the hurricane hit, it closed the factory, resulting in staffing shortages and an IV supply shortage in the United States. In fact, even a month later, they still had staffing shortages, with less than half of their staff reporting back to work. And these effects on being able to access care or not have effects on cancer survival, not unexpectedly. This particular study looked at the relationship between patients with breast, colon, and lung cancer exposed to Hurricane Katrina and their 10-year survival. They found a 15% increase in mortality among breast and lung cancer patients who were exposed to Hurricane Katrina. 15% increase in mortality just because of having problems with access to care. And it's not just treatment delays for advanced cancer patients. This was a study that looked at over 1,900 patients who were undergoing definitive thoracic radiation therapy for their curable stage 3 lung cancer when hurricanes hit their neighborhoods. And they compared their outcomes with about close to 130,000 patients also undergoing radiation therapy, but not exposed to hurricanes. And look at the difference in outcomes. If not surprisingly, if patients did not experience a hurricane, their treatment plan was significantly shorter than those people who were supposed to be getting radiation during a hurricane disaster. And again, not surprisingly, the survival compared to people who had exposed to hurricanes versus not, was 11 to 19% lower. And if those disasters lasted a really long time, 27% lower. Okay, so all that sounds pretty dismal, but we can do something about it. We can. After all, I would say that we as Americans have struggled with such things before. For example, we have made countrywide changes which allowed us to get electricity across the country, or sanitation across the country. So we can struggle with this and do what we can to protect our children, grandchildren, and health as much as possible. So what can we do? Well, one thing we can do is be good examples and watch your personal actions. If a large majority of this is coming from burning fossil fuels, we should ride gas-powered vehicles less frequently. That means walking and biking more, telecommuting, electric cars, Zoom meetings, virtual meetings. We should be using clean energy, and that means solar, wind, geothermal energy, and electricity. Something we didn't talk about is the amount of greenhouse gases that come from agriculture. And so eating less believe it or not, and cows burp a lot of methane. And again, methane is a greenhouse gas, a very dangerous one. It's more potent than carbon dioxide. So we should be eating less red meat to decrease the amount of cows burping up this toxic compound. Ooh, what's happening here? Okay. What else can we be doing? We should be educating our peers, our patients, the public, policymakers, healthcare organizations, and professional organizations. We should be out there talking and telling people about the relationship between climate change and cancer, and how climate change is making cancer outcomes worse for everybody. We should be speaking up and advocating locally within our healthcare systems and within professional organizations. The U.S. healthcare represents, of all things, about 8% of all carbon emissions. Now, that may not sound like a lot, but it is one of the top 5 or 6 professions that emit carbon. We should be supporting climate change and environmental nonprofit organizations. I mean, everybody is busy. Everybody says, how can I possibly do this and live my life in a regular fashion? Well, there are some groups that do nothing but this, and that is they advocate for policies that will hopefully decrease environmental issues and climate change. And these environmental nonprofits can use your support. We should be advocating, and we can do that in a number of ways as well. Speak up locally. Your community, speak up to your community and your health system. There's lots of community local organizations that could need to learn about these issues and can start advocating for them, such as civic meetings. You can write letters to your editors. There's always petitions going on saying support or don't support this particular law or not. And advocate regionally and nationally as well. So you can write to your policymakers, your representatives and senators, or better yet, they take this very seriously. is you can actually call their offices. Now, that sounds scary, or at least it did to me when I first did it, but it turns out it's not scary. You're not going to be speaking to your senator. You're going to be speaking to some nice aide who will write down your thoughts and promise to give them to the senator. And why they may not always read the complete text of the petition that you're sending or of what you say, it is the number of people who contact them that matter. And by that, what I mean is, I don't know how many of you have heard of the 3.5% rule, but this is a concept in political science that suggests that a nonviolent protest movement involving 3.5% of a population can effectively challenge and potentially overthrow an existing government or regime. And that's based on research showing that nonviolent campaigns are significantly more successful than violent ones, and that all it takes is 3.5% active participation within the population. And that has historically led to success in achieving systemic change. So 3.5% of the United States population is still a large number, but if every one of us does just one little thing, it can have a major effect. And I just would like to leave you with two thoughts. This is something from Margaret Mead, an anthropologist and Presidential Medal of Freedom Award, who said that never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. And please remember, there is no planet B. So with that, I'd like to thank you for attention, and thank you also for hopefully supporting Oncologists United for Climate and Health. We are a nonprofit organization that focuses on the intersection of climate change and cancer. Our mission is to advance awareness, actions, and policies that will mitigate the effects of climate change on human health, cancer incidence, and outcomes. So with that, I thank you, and I would be happy to answer any questions. Now I just got to figure out how to stop sharing my screen here.
Thank you, Dr. Schiller, for a great presentation.
Yeah.
You really did a excellent job of laying out, how air pollution arises, particulate matter and its impact on cancer with and lung cancer with and without history of smoking. Earlier in your talk, while we wait for people to put in questions, you had a slide that you talked about one of the chemotherapy agents, and you wrote DITC. So for those that are not physicians, what is DITC?
It is an older type of chemotherapy. The DTIC represents the different chemicals within this older form of chemotherapy, and it was used a lot in the treatment of Hodgkin's disease.
Because I just wanted, for those that didn't know, what is this? Because sometimes you see an acronym.
Sure, of course, yeah. Any other questions out there?
Yeah, Jim, go ahead. There was a question. It said, you said particulate matter can get into the bloodstream. What types of illnesses can that cause?
A whole bunch of systemic illnesses, everything from cardiac disease as it gets into the cardiac vessels and into the cardiac muscle. It causes cardiovascular disease, so they definitely go up because of air pollution. It causes CNS disease, strokes, for example. It can cause other cancers, like I said, breast cancer, because of this chronic inflammation. It causes all sorts of problems for pregnant women, resulting in babies that are either stillborn or premature. So it can cause widespread abnormalities.
Someone had
Chris,
asked,
I was just going to
but
ask if Chris had anything to add there.
There's some information that air pollution increases the risk of Alzheimer's disease, which, as our population in the US ages, is clearly a concern.
Good point. Thank you.
someone had asked about leukemia in the particulate matter.
Chris, do you want to handle that?
It's my review of the available information is that there does not, surprisingly, seem to be much related to leukemia. There are carcinogens in the water and fluid that is used to extract the the natural gas. Fracking, you may have heard of that, and the wastewater that comes up from that contains quite a number of carcinogens because you have to use these materials in the water to extract the gas. And there have been reports of increased leukemia surrounding fracking places. So it's not directly from the particulate matter, but it is an associated consequence of our rush to extract fossil fuels.
And I would say that that is particularly in children. There's
Right.
there's been a higher incidence of leukemia in areas around fossil fuel fracking and production.
Exactly. And for Jackie's benefit, given her interest in radon, there is extraction of the naturally occurring radioactive materials that are down deep where the natural gas is. So there is radon in the effluent from these fracking materials, and that can be harmful. We here in Maryland do not allow the spraying of this liquid on asphalt for snow removal and preventing ice buildup. And there are some jurisdictions elsewhere that allow that. And I think this is an action that citizens in those areas can learn about and hopefully try to prevent.
Slightly unrelated. I know in Oregon, I lived in Oregon for a while, and they never put salt on the roads. I forgot what they did, it was never salt. But I grew up in Michigan and they use salt all the time. And you just think about all the runoff and what that's doing to the environment just from water quality. And it's
Yeah.
just, and children are absorb so much more, but they're also so much more susceptible to the effects of these chemicals.
Yeah, exactly. And one more point, those individuals who live in the region of the Great Salt Lake, that lake has been drying up and there are now dust storms. The concentration of heavy metals such as arsenic is increased in the dust from the lake beds, and that's another hazard of climate change. Is the dust storms and another cause of air pollutants that are harmful.
See, does anyone else have any other questions? And while we're waiting, I really like that you pointed out, people think that, well, if this forest fire is over here, it's not going to bother me, but they forget because of the jet stream, all that particulate matter just floats across and then it just lands and then it still keeps traveling. And like I said, I'm an asthmatic, so Oregon forest fire season was never fun because you just get it in and you can't really get it out of your lung.
That's for sure. There's all sorts of photographs taken, like the one I showed of the Statue of Liberty, clear day versus a forest fire pollution day. Yeah.
One thing people might want to realize is that the N95 masks that we were wearing to prevent transmission of COVID also can pretty effectively filter out particulate matter, the PM 2.5 size that Joan was mentioning. So it's something that individuals can monitor the air quality around their home and neighborhood and where they're traveling, and patients can do the same and revert to mask use when it would be required. You don't need one of those very fancy, respirators with oxygen attached to it. Nothing too expensive like that. The N95 masks are sufficient.
Hey, Chris, can I ask you, you probably know the answer to this. Like in San Francisco, a couple years ago, they had the really bad fires and really bad smoke from the fires. What should people, if they're staying in their houses, do in terms of purifying the air?
There are portable air filters that have HEPA filters on them that I don't remember the precise grade of the filter, but the manufacturer will provide information. And so the HEPA filters can be used, for example, during the wildfire smoke from Canada that affected us. I put a air filter in my office where I was spending my most time. So office and bedroom and potentially kitchen as well.
Mhm.
Yes, Jackie, you raised your hand.
Thank you. One question it just sparked with me. Volcanoes. One of the things that I have seen, and you've seen it too on TV, then everyone rushes to, wherever the volcano was in Hawaii, and they would stand there and they would take the pictures and whatnot. Because that is something that basically comes out of the ground. Wouldn't the radon levels be high in that area?
It's an excellent question that I don't
Yeah.
know the answer
No.
to.
The particulates are dangerous, as you allude to, and I certainly don't think you should be rushing to the proximity of the volcano to breathe in those particles. So I do think that's harmful. I do not know the radon answer.
So smoke from volcanoes, however, does contribute to greenhouse gases. And I forget the volcano that went off sometime in the past, hundreds of years, covered the whole earth. And they call it the year there with no summer. I think it was called. It was in the early 1800s or 1700s.
1800s.
Yeah.
Interesting.
Great.
Right. If there are no other questions, I want to thank Dr. Schiller and Dr. Berg for joining us today. Thank you so much for your time. It's greatly appreciated. Like I said, as a reminder, we have our next session coming up October 14th with Dr. Laura Stiebel. And then we have our next webinar with Melanie Potiampai on SHEC tomorrow from 1 to 2 p.m. Eastern Time. With that, we hope that you have a great day. And if you have any other questions, just send them in and we will try to get them answered. And with that, we'll let you all go. Thank you so much.
Thank
Thank
you
you
very
again.
much.
Thanks. Bye-bye.